Hi there, my name is Zach Snyder, and I'm our Vice President of Government Affairs here at Quest Analytics. And what I want to do today is give an overview of the network adequacy and essential community provider updates that we see in the 2027 Notice of Benefit and Payment Parameters. This is the annual rule that CMS puts out that places requirements on health plans that want to participate in both the federal and the state exchanges. In this year's rule, we see some big changes coming to network adequacy overview. And the way that I see it is that there are really 6 domains that impact network adequacy oversight and essential community providers in the rule. Look, the rule is 500 pages long. It touches a lot of different issues, ranging from marketing to standardized plan design. What I'm going to focus on today are those areas related directly to network adequacy oversight and essential community providers. And there are 6 domains that I want to talk about. So the first domain is CCIIO network adequacy oversight in the federally facilitated marketplace. That remains unchanged. CCIIO will continue to conduct annual network adequacy oversight for QHPs offered on the federal exchange. They will continue to collect the network adequacy template from QHPs, and they will continue to use network adequacy time and distance standards. The second domain that I want to talk about is a new optional provider access review program for federally facilitated marketplace states, for federal exchange states. So states in the federal marketplace will now have the ability to meet a program and opt in to conducting network adequacy review in place of CCIIO. The third domain is non-network plans. CCIIO and CMS are allowing the reintroduction of non-network plans into the marketplace, and there's new requirements on payers that are offering non-network plans. The next domain is changes or new flexibilities provided to both state-based exchanges and state-based exchanges on the federal platform. The next domain is a new optional effective essential community provider review program. So this is a program similar to the one I talked about with the network adequacy program, where states can opt in and conduct their own ECP reviews in place of CCIIO. And then finally, there's a revised ECP threshold. So QHPs, they're moving from a 35% of available ECPs to 20% of available ECPs. Going into the first domain, this is all about CCIIO network adequacy oversight. CCIIO will continue to conduct network adequacy oversight of QHPs in the federal exchange. They will continue to collect the ECP network adequacy template from all QHPs offered in FFM states, and CMS will continue to use its time and distance standards. On the right-hand side of the slide, you can see the different exchange types that exist today. As it relates to network adequacy, the way I see it, there are 4 exchange types. There's the federal marketplace, that's the deep blue. There's the state-based exchange on the federal platform in 2026, that's the light blue. There are 2 states. There are the state-based exchange states, those are the green ones. And then the orange states, these are the federal states, but they've been granted plan management oversight authority by CMS. And those 4 states are actually already allowed today to do their own network adequacy reviews. And I think that leads really nicely into the next domain, which is the new optional effective provider access review program that FFM states can opt into. 4 states today have that authority. This is really a formalization of that process. And there are 6 parts to the process that you can see on the slide here. States will have to prove to CMS that they have all 6 parts, and that includes having in statute or regulation network adequacy standards. They don't necessarily need to be the specific CCIIO time and distance standards, but you're going to have to prove as a state that you have network adequacy standards in statute or regulation, that you have a data collection and reporting infrastructure, so you have a process of collecting data from the payers, analyzing it and making decisions about whether or not those payers are actually meeting your network adequacy standards. You have an enforcement framework. You have the ability to reach out and engage with payers through an enforcement and have a justification and exception process available. that you're posting your certification procedures and timelines online in a way that is accessible for the payers, and that you are also having a consumer access monitoring program. Most state DOIs have this, but that you have that available to accept complaints from consumers and address those. And then finally, this is a new one, but that you have a non-network plan oversight mechanism. So this is new in the rule, and we're going to talk more about that, but you have a way to collect and evaluate whether or not non-network plans are meeting requirements in your state. As I said at the beginning, CMS is reintroducing non-network plans into the market. They're allowing non-network plans to be offered. They used to be allowed, CMS then disallowed them, but now they're allowing them again. And there's a 9-part program that payers must demonstrate to CMS or the state regulator in order to effectively offer these non-network plans in the market. And the way I see it is it's kind of a quasi-network adequacy analysis. We haven't seen the letter to issuers yet, and there might be more information about what is required of payers in order to meet this requirement. But one of the biggest areas that the payers will have to demonstrate to the state or to the federal government is provider acceptance rate. Do providers in the area that the non-network plan is participating in accept as payment in full the benefit amount of the non-network plan? How this is accomplished, we don't quite know yet. Will this be accomplished through provider surveys or through a claims analysis? Maybe. More will come about that in the next weeks, and we should see lots of comments on this area as well to CMS. So moving from the FFM states to the state-based exchange states, there are changes there. CMS is removing the requirement that state-based exchange states have explicit time and distance standards for QHPs that match the CCIIO standards. And they're moving towards a standard that they had before, where they're requiring states to meet the generalized network adequacy standards found in state regulation, found in federal regulation. And you can see that on the right. The general standard is states need to ensure that QHPs have networks that are sufficient in number and types that all services can be accessed without unreasonable delay. So states will now have more flexibility. Many states have tied to the federal standard, SBE states, so we will see what states do as a result of this. I will also note that in the requirements, SBE states must have a program in place to accept that information from the non-network plans and evaluate compliance with those non-network plan requirements that we just discussed. In addition, states will also have the option to opt into an effective essential community provider review program, so take over ECP review from CCIIO, similar to what we just discussed in the network adequacy overview program. The state will have to approve many different aspects to CMS. This is a 10-part program, and this includes having the legal authority, having standards alignment with federal requirements, having issuer reporting requirements, and several other elements here, including a non-network piece to this as well, because in the non-network piece, payers are required to demonstrate that 20% of available ECPs will accept the benefit payment in full. And moving to the one of the final slides here, in the essential community provider threshold, CMS is lowering it from 35% to 20%. We've seen them lower this before. It's been at 30% in the past. It's been at 20% in the past. They're lowering that, and they're also removing the justification requirements. They're removing the narrative requirement, and now issuers are submitting their contract status directly in NPMS. And there's going to be no change in how CCIIO is collecting this information in the ECP data that's collected in the ECP NA template. So then finally, there are many, I think, questions and outstanding issues for both plans and states. On the right-hand side, you can see here are states that currently conduct network adequacy reviews in the federal marketplace. There are 4 states, but there are many other states that have plan management authority. Do those states apply for network adequacy authority? We don't know. Will plans offer non-network plans? there are no changes with the federally facilitated marketplace at this time. So that is not changing, but what we will see is states may apply for authority. With all of that said, CMS is continuing to collect feedback from all stakeholders, and they will be receiving that feedback through mid-March, and they will be publishing their rule shortly after that in anticipation of the filing deadline for the 2027 plan year. So as more information comes out, we will continue to update you. But this is what we know for right now, and it'll be very interesting to see what happens. If you do have any questions about this, you can always reach me at my email, and I'd be happy to discuss with you. So with that, I hope everyone has a great day, and I'll talk to you next time.